What's up everyone, welcome back to a brand new video on the Cuspide Insurance YouTube channel. My name is Carlos, I'm a licensed life and health insurance agent, and today we are going to be on the marketplace, on the health insurance marketplace. I'm going to teach you all how to read an insurance plan, how to dissect all the terms, all the meanings, so that next time you're on the phone, you understand what everything means. Let's get into it. Okay, so on the screen here, we have what the health insurance marketplace looks like when you put in all the quote information like age, income, all that stuff, dependents. So for this example, there's no dependents, it's just one person. And here we have a plan with Aetna, CVS Health. All the companies are gonna appear on the top left. So this is what agents use to quote, and here it is. So let's start with the basic information that everybody wants to know is how much they're gonna pay a month. It's up here. This is what the premium is, $14.58 a month, because they have a $326 tax credit. You can click the link here if you want to learn what tax credit is, because I'm not going to talk about it in this video. That's a whole video of its own, because there's a lot of information there. So they added this recently, estimated total yearly cost. We're going to skip past that. That's don't need to know. That's not even accurate. So deductible. This plan is a zero deductible. As you can see, it says health zero. Now the medicine has a deductible, but that doesn't count either. We're going to talk about that in a little bit. So I always try to give clients a zero deductible plan, because what a deductible is a payment that you have to make before the insurance company helps out. So if you have to do like an MRI and it costs you $2,000 and you have a $1,000 deductible, well, guess what? You have to pay $1,000 to be able to get that MRI done, because it costs $2,000. So you're not even completed that full other half of it. But once you pass the deductible, then the insurance company helps in. So that's why zero deductible health plans, you have to try and aim for as low as the deductible possible. Now for this person, it's going to cost them $14 a month for a zero deductible plan. Next up, we have the out-of-pocket maximum. This is the max that you will pay out of your pocket. For this plan specifically, it's $9,400. So if they have a surgery and it costs $50,000 surgery, all your money is going to be down there for sure. So you can expect to pay $9,400 for that surgery, because no surgery is cheap. So $9,400. After you pass this number, the insurance company will cover everything for the rest of the year. So no matter any doctor visits, anything that you could think of, after you reach this out-of-pocket max limit, the insurance company will cover everything. So obviously this is also a good number to try and get down, but the more down you get a deductible and out-of-pocket max, the more premium you're gonna have to pay. So try and meet in the middle, depending on your income. Primary care, these are the co-pays. All of this that you see here are co-pays. So a co-pay is a fixed amount or a percentage that you pay for the service. So for example, a doctor visit, here you can expect to pay $15 per visit. So every time you go to the doctor, you're gonna pay $15 to your primary doctor. A specialist for this plan in specific is $100. So anytime you wanna see your specialist, you're gonna have to pay $100 per visit. And obviously all of these numbers go into the out-of-pocket max. So if you were to visit your specialist doctor 2 times, that's $200. Your new out-of-pocket is $9,200. So all the numbers that you see here will be subtracted from the out-of-pocket max. So keep that in mind. Urgent care, $50 a visit when you go through the urgent care. And the emergency room is $2,200. So every time you stay at the emergency room, it is going to cost you that much. No emergency is cheap either. It's better for this to be a fixed amount instead of a percentage, because some plans have like, it says emergency room, and here it says like 30%. But you don't know what that 30% could be. It could be a lot of money. So would you rather pay $2,200 or 30% of like $100,000 and then have to pay really close to your out-of-pocket max? So obviously some people prefer a fixed payment for the emergency room. Outpatient mental health, $15. And another important number is the generic drugs, which is pretty much the prescription drugs, are $40 per medicine. Obviously, if it costs less, then you're only going to pay that. but for the most part, it's going to cost you $40. And down here, some plans do include child dental and adult dental. Not Aetna though, I think Better does, and a few other companies. You have to, if that's what you want to get, then you have to try and look for a company that does offer child and adult dental. And some even offer vision as well. Okay, so what I did here really quick is I went and switched it to 2 people applying for coverage now so I could show you something. So as you can see here, the out-of-pocket and deductible both say family total. So for the out-of-pocket, this family total is actually going to be split into 2 since there's 2 people applying. So for each of them, it's $3,000 out-of-pocket max. So when you see $6,000 family total, you know it means split it in half, and it's only capped at 2 people. So one person, $3,000, and the other person, $3,000. So if one reaches it, they're covered by the insurance company for the rest of the year. And if the other person hasn't reached it, then they still have to do all the co-pays, all the deductibles, all that. And same thing applies for the deductible. And that's pretty much it. That is how you read a health insurance plan. Those are all the terms and all the definitions of kind of how to break down a plan. There's also there's a comparing options, but I'm gonna leave that for another video. And I wanna let you guys know that if you live in any of these states on the screen here, Florida, Texas, Georgia, all of that you see on the screen, you can give us a call at 305-970-8583. You speak directly with me. I will help you and your family get the affordable health coverage that you need and that you deserve. All right, so thank you all so much for watching. Make sure to like and subscribe to the channel. It helps it out a lot. I'll see you all in another video. Take care, everybody. Bye-bye.